Welcome everyone. It is Tuesday, June 16, and I'm welcoming you all to our weekly virtual information session on the coronavirus. My name is Dr. Anna Fall and I'm the Executive Director at the Traeger Institute, and really excited to have this discussion today about the opening of the healthcare professions. So, before we start, just make sure you keep your microphone on mute all the time. And if you have a question, please put it in the chat. And then at the appropriate time, we will start asking the questions. We want to make sure that if you are concerned about your health, that you call us at 588-4340, or you can call the Kentucky COVID-19 hotline at 800-722-5725. The next slide. If you have any issues with your microphone, please first of all make sure that you have your phone, your sound muted. But if you have any issues you can't hear, you can go here, as you can see on the screen, to check what to do. And now, as usual, I would like for all of you to just type in the counties that you represent, either as a professional or where you live as a resident of Kentucky. That would be great. And now, again, while that is happening, I'm going to give like a second or two to get that done. Let me just type mine as well. I am going again, in the tradition we started about 2 weeks ago. We are going to, again today, to have a moment of silence and reflection. We will continue with our 1 minute of silence to honor our over 2 million American citizens who's been infected with COVID-19 and the 116,000 who have died. We also will use this minute again to reflect on a society who is battling racism and systemic injustice. Let our moment of silence begin. I thank you all spending the time in silence with us. Now I'm very excited to welcome Dr. Laura Morton again to give us our weekly update on the coronavirus before I use the rest of the panel. So Laura, you have the floor.
All right. Good morning, everybody. Thank you for having me here today. Just want to give a quick update on the coronavirus. And as of yesterday afternoon, the total cases in Kentucky are 12,647, and total deaths in Kentucky are up to 505. Governor Beshear, if you've been watching the 4 p.m. Update from him, will now be transitioning to doing it on Mondays, Tuesdays, and Thursdays. So he is decreasing. Some very important things to remember is that we all continue to wear masks to protect yourself and others. I know there was a little bit of confusion from the CDC, and Dr. Fauci did correct that last week. Other things for continued reopening per Governor Beshear: social distancing remains very important to maintain the 6 feet of distance, testing and repeat testing. So if you've been out, been exposed, or been in a larger group, go ahead and get tested at one of the sites, and also contact tracing, and more will come on that. The other thing that he continues to reiterate is for everyone to complete their census. So if you work with people who haven't completed the census, go ahead and encourage them, as it's very important for funding that will come to Kentucky. And you'll hear more about this, but on last Thursday, Governor Beshear announced some dates regarding long-term care and congregate living. And June 29th, communal dining and activities are going to restart in a limited capacity. and July 15th, visitation to restart in some form of limited capacity. And we'll talk more about that later today. But that is the COVID update. Thank you.
Thank you, Laura. And if you have got any questions for Laura, you can just put it in the chat and we will get to that at the end of our panel discussion. So now for our panel discussion today about healthcare reopening. At this session, we are going to host a panel discussion with experts from a cross-section of healthcare services, including oncology, dentistry, acupuncture, and long-term care. As the first industry to reopen, the healthcare panel will share with their respective what their respectives are doing to keep patients, especially the most vulnerable, safe and well cared for. Panelists will also discuss the lessons learned so far in healthcare reopening experience and share important tips for how patients can be best prepared to re-engage with the full spectrum of their healthcare providers. So our panel members are the following people. Michael Egger, he is assistant professor at the James Graham Brown Cancer Center, and he is working in the Department of Surgery at the University of Louisville. Welcome, Dr. Egger. And then we have Andrea Helton. She is an acupuncturist and also has a specialty in herbal medicine, and her husband, Colby. He has a doctorate of acupuncture and herbal medicine, and they both run the clinic AcuBalance and will shortly be joining us at the Trager Institute as well for 2 half days a week. Then we have Margaret Hill. She's the associate professor in the Department of Oral Health and Rehabilitation and the associate dean of postgraduate education at the School of Dentistry. Welcome, Margaret. And then lastly, we have Laura, who already talked to us. She's Dr. Laura Morton. She's associate professor and the director of the Division of Geriatric Medicine in the Department of Family and Geriatric Medicine. Welcome all of you to our panel. We have for all of you one first question that we all ask you to prepare a short statement on. And the question is, can each of you share the basic safety precautions that your healthcare field is taking in light of COVID-19? And I'm going to ask Dr. Egger to start for us and give us the update on that question.
Great. Thank you all for having me. I really appreciate the opportunity to represent the Brown Cancer Center and give you an idea of what cancer care looks like now in the sort of post-COVID or intra-COVID era. And I think it's important to think about it in 2 different areas, both in the outpatient setting and the inpatient setting. So first of all, from the outpatient setting, and this is true for anybody visiting the doctors, being medical oncology, surgical oncology, radiation therapy, whether they're getting chemotherapy, it will look different. And the way that will look different is mostly with visitor limitation. And so most centers are allowing only 1 visitor per patient. In the midst of it all, we were not allowing any visitors at all, and just the patients were coming in. And so spouses or partners or whomever might be with the patient at that time were waiting in the car and could not come in. So that has loosened up somewhat, and a lot of places are now allowing up to 1 visitor. But you'll see that the waiting rooms, if you think about waiting rooms, you think about how crowded waiting rooms can be. That's a thing of the past right now. And so those efforts of limiting visitations and then spacing out appointments such that we don't have a lot of patients stacked up waiting to come in, you'll find that the waiting rooms are not nearly as crowded. People will be wearing masks. So your provider will be wearing a mask most likely, and all the patients are wearing masks as well. There'll be temperature checks when you walk into the buildings, and there'll be a quick survey, a questionnaire on exposures and your general health at the time. And then thinking about the changes I think that have been made for the positive, which I hope will be long lasting, are telehealth options. So I think for cancer care, this really made us jump into telehealth. And that I think will be a positive to come from this. And so you will find that cancer patients can get their checkups via telehealth by their provider. They can get their scans done locally and they don't have to travel. And so I think, and we'll talk about kind of the questions to ask, but in general, I think the telehealth options have expanded greatly, and we're doing a lot of cancer care, particularly symptom checkup and surveillance, and even new patients. So I just got off the phone with a lady from Campbellsville And we scheduled surgery for her. So I'll meet her the day of surgery, whereas before that would have taken at least one, if not two office visits, and she doesn't have to drive up from Campbellsville now. On the inpatient side of things, and I won't take up too much more time, but again, visitation limitation is the biggest thing that you will have seen us do, the changes that we make. So for patients coming in and getting surgery, their family members in general aren't allowed to come into the hospital with them. So again, those waiting rooms that are not as crowded. Most hospitals, certainly in the downtown area, are now allowing one visitor per patient per day at a sort of a designated time. So that has been relaxed because back in sort of March and April and even first half of May, there were no visitors allowed. And then you'll see a lot more COVID testing. And so, for instance, for surgery right now, every patient needs a COVID test before they're allowed to have elective surgery. And so, and then, you know, cancer patients getting like chemotherapy or something like that, they are sort of very liberal with testing for any symptoms. And so I think that's just a general summary of kind of some of the changes we've made both in the inpatient and outpatient setting for our cancer patients.
Thank you. I appreciate that overview. Dr. Hill, you next, dentistry. You're on mute, Margaret. Yeah.
It works better when I'm unmuted, doesn't it? I bring you greetings from the University of Louisville School of Dentistry. I echo everything that Dr. Egger said applies to patient care in the School of Dentistry, except in our case, it's all outpatient stuff as opposed to, I will say we try real hard not to have folks in the hospital unless we absolutely have to. All the things apply. It looks very different. Screening is different when you walk in the door. Everybody has to be screened when they walk in for symptoms. We take temperatures. We're being very careful about being sure that we can assure everyone's safety in the building at all times. The most interesting thing about dentistry to me that applies to this whole business of COVID-19 and the changes is that we really have to be aware of the fact that we make aerosols. You've heard people talk about the fact that this disease we all know more about aerosols now than we've ever known before because the disease is carried by aerosols, by droplets, respiratory borne. We talk about wearing our masks. We talk about protecting ourselves in all kinds of ways. Well, think about the last time you went to the dentist and all of the aerosols that are created with everything that we do. There's virtually nothing in the dental office that happens that doesn't involve aerosol. We realized very, very quickly that we had problems that had to be addressed. And I'm so happy to be able to tell you at the School of Dentistry that we have very successfully addressed those problems. And I'm willing to put our facility up as being the safest place that you could get dental care, certainly in the city, likely in the state, and maybe in the nation. I'm willing to go that far. It was a wonderful coincidence of a remodeling job that we did a few years ago and the HVAC system that was put into the school. We've been able to create, as a result of that new HVAC, sheer blind, dumb luck got us a hospital grade HVAC system. And with just minor changes in our HVAC, we've been able to create areas that are the equivalent of negative pressure areas. And it pulls all of that aerosol stuff out and away and puts it through hospital grade filters. We've added to that some additional scrubbers. So we have many areas in the school that are the safest place that you could possibly have this work done. I think that's something that as you seek dental care in your own dentist's office is something you need to be watching for and looking for. How are they managing aerosols? How are they protecting themselves? How are they protecting you? We all can pick it up from each other. So it's a question of protecting everyone, not just protecting the folks that work in that environment, but also protecting the patient, protecting anyone who comes with them. There will certainly be limitations like Dr. Egger talked about on who can be with you. Waiting rooms are no longer existing. You'll probably be called or texted in order to come into the office. But as you're seeking care in a private practice setting, be sure that you're paying attention to that to make sure that everyone is as safe as they can possibly be. Thank you.
Thank you, Margaret. Andrea and Colby, you want to share from acupuncture side?
Excellent. All right, thank you. And thank you, Dr. Anna, for having us on today to kind of represent acupuncture and the integrative field. We kind of wanted to start off just by saying with acupuncture specifically, so previous to COVID, a lot of people don't really know what goes into the safety of acupuncture. So we have pretty robust cleaning and safety procedures pursuant to what's called the Clean Needle Technique program that we all have to complete, and something through OSHA. So obviously all the needles always have been and always will be single use and disposable. We really focus on clean hands and surfaces, single use sheets and face coverings, and obviously disinfecting any surfaces and supplies between uses. That's always been part of our protocols. Since COVID, we've kind of separated our approach into 3 different categories. We've kind of got our appointment and patient guidelines. So we're still trying to prioritize telemedicine for consultations. Obviously, I've gotten rid of the waiting room. So we're doing the parking lot lobby with screening. We take their temperature, kind of do a symptom check, and have all of our patients sign a special consent form. We are asking all of our patients to come alone unless they require a caregiver. Masking is required, non-negotiable. We ask all of our patients to wash their hands or use sanitizer upon entering or exiting the facility. And we also encourage all of our patients just not to touch any surfaces. We try to open and close doors for them. We also have done what's called like a staggered appointment. So we're preventing patients from interacting with one another. So the idea is that they get brought back and put in their rooms before another patient is kind of out. So there's just really no loitering in any of the hallways. Try to practice social distancing, obviously, except for during the actual acupuncture treatment. And we're doing what's called a virtual checkout or an in-room checkout, where we just ask patients to pay online or schedule online. So we do very, sorry. There we go. In terms of like provider guidelines, obviously with the providers at our clinic, we have both, Colby and myself and a massage therapist. So we distance each other. We have our kind of designated workstations. We wear PPE. So we're doing scrubs and lab coats, surgical masks, closed-toed shoes. We wear gloves when we're cleaning. We have found that the cross-contamination is too risky doing gloves while actually treating acupuncture patients. So we just keep hand sanitizer in our pockets and wash them after we touch anything. So we wash our hands a lot throughout the day. My poor hands are pretty dry and cracked right now. Also, we are recommending some kind of routine testing for all of us. So far, I've had a test so far. It's not super comfortable, but it's not terrible. So we're kind of waiting on guidelines from the medical board and the acupuncture board in terms of how frequently, but we are going to start instigating some kind of like routine testing approach. We're also encouraging all of our providers, so our massage therapist and Colby and myself, to kind of step outside every couple hours to kind of take our masks off and get some sunshine and air, because wearing a mask for 10 hours a day, 5 days a week is not super fun. And we also, just with myself as kind of like the designated safety officer at the clinic, we check for updates from the CDC and public health department regularly, just to look for any updates. In terms of the clinic itself, as I mentioned, the providers were there to kind of open and close the doors and just kind of like guide patients so they're just not really touching anything. We disinfect the bathrooms between uses. We keep all of the doors closed in the clinic, so no extra space opening. And we keep our clinic door locked, so patients are just kind of let in and out by us, and then we disinfect the doorknobs after they're touched. And as always, like, sheets are changed after every patient and laundered on a sanitation cycle. And now we're also using a covered linen container, so sheets just aren't lying out in open space. And then that container is disinfected as soon as the soiled linens go into the wash. So like to think we're doing everything we can. When you're working in integrative care, I kind of feel like we always have to work extra hard to prove ourselves. And so I was actually responsible for writing the safety procedures for the acupuncture field in Kentucky, and feel like we've done a pretty good job, but are always keeping an eye out for ways that we can improve.
Thank you, Andrea. Dr. Laura Morton, Want to share from the long-term care field?
Yes, thank you. And again, thanks for having me to talk about COVID and to talk about the long-term care facilities. As I'm sure everyone is aware, long-term care has been under a pretty significant lockdown since March, per Governor Beshear's order, as well as from the health department. It's been very essential in trying to minimize the spread of COVID into these frail, fragile populations in the congregate living settings. And just as an update from yesterday from Governor Beshear, right now we're currently doing the widespread testing across the state of Kentucky in all long-term care facilities, which is going well, and it should be completed, I think, around in July. And currently, as of yesterday, there's 1,516 positive residents, 724 staff, and there's been 323 deaths within the long-term care facilities. And that represents 3 staff and 320 resident deaths. And so again, this is a very frail population. So the facilities and the industry has been very aggressive with their procedures to try to keep people safe. So there really hasn't been any visitation except for some compassionate care end-of-life visits for family members of those who are actively dying. They also have really restricted vendors and other non-essential healthcare team members coming into the facilities. The other thing that's been an increased use of telemedicine. So through Traeger, we've been using the Vuzix smart glasses and also as a way to do telemedicine in more creative ways. You're also seeing that as more specialists are being available via telemedicine to really safely provide care to these frail older adults so that they're not going out and risking bringing something back. Anybody who goes into a facility, any of the staff members, they're all being screened, that everyone is using a consistent entrance so that they get everybody to do the questionnaire, to do the temperature check. You'll see masks. We're actually encouraging the patients as well, the residents who live there, to wear masks, though we understand that some people, if they have dementia, are really not able to understand or tolerate those masks, which is one of the complicating factors of some of these congregate living settings. And that has gone a long way to trying to minimize and reduce the risk of transmission. We have not been doing communal dining, and activities have been limited during this time period. As I stated earlier, we're looking, and on the long-term care task force, we're working toward finding some recommendations and guidance to help start opening back up these facilities, as we understand the risk of social isolation is very high in these older adults as well. So hopefully, in June 29th is the day for communal dining and activities to restart, and there will be some guidance around that, and it will likely be at limited numbers of people. And July 15th is supposed to start for visitation. And again, that will probably have some more restrictions. And hopefully in this process, we're starting to allow some of the other healthcare members to come in, including podiatry. A lot of these facilities have dentistry that comes into the facility, and as well as the eye doctor. And so these have been on hold for this time to try to minimize that risk, as a lot of these providers go to multiple facilities. The other thing the nursing facilities have done is really to focus on their staff and make sure that their staff are working at one facility. A lot of times people will work at multiple facilities, but facilities have been trying to minimize that as well. Per the CDC guidelines for reopening long-term care facilities, they were recommending testing once a week. I think the Kentucky State Department of Health and each state is kind of approaching that in a different way to see what's manageable and what testing capacity you have to do that. The dates that are coming up in July for the visitation will likely be when all of the testing has been done, the baseline testing for all the long-term care facilities across the state. So that's where that date would coincide, because before they reopen, they want everybody to have a baseline test to know where cases are and cases are not. And I think the facilities have done a great job of being creative. And that's the biggest thing that's come out of this, is creative ways to maintain resident safety while allowing someone to see their loved one. And once people move in, and someone put that in the chat, the 14-day quarantine for people when someone moves into a community. I know it's been challenging for people, but it's trying to minimize the risk of bringing something into the community. And it really has helped us maintain the risk of transmission. So if somebody new came in, they went into usually a certain area, if they were in long-term care, to go through this quarantine period. But I think hopefully, and we're all excited, and I know everyone in long-term care staff and residents and their families are excited to look forward to how we're going to come to a new normal in our setting, with the understanding that as we progress through COVID and until we have a vaccine, that there's likely going to be some ebbs and flows in what's open and what's not. As I would anticipate, if there becomes any surges, then things will probably be locked back down. But again, they've been doing everything we can to possibly minimize the risk of transmission and getting into the building.
Thank you, Laura. The next question is for Margaret from dentistry. And the question is, what is your field's main concern or challenge as you work through the reopening?
Oh, the aerosols. By far dealing with the aerosols. I'm involved in a number of communications with people across the country, both in private practice and in academic dentistry. And by far the challenge of how we deal with aerosols is tremendous. We made the decision to move our faculty practice operations back to the School of Dentistry rather than staying in the HCOC building, because we couldn't figure out how to manage aerosols over there. And we knew we had a safe place here, so we made the decision to shrink things a little bit here at the school in order to make room for the operation for faculty practice, purely for safety issues. Everybody's facing it, so that's a huge issue for us.
Thank you. Acupuncture. Have you seen a reluctance in people seeking preventative care? If so, how are you working to correct this?
Yeah, so we reopened again on May 4th, and you know, we have a small percentage of patients that have been a little bit reluctant to reschedule, mostly just if they're in a more vulnerable population. But to be honest, most of our patients were kind of chomping at the bit to get back in. A lot of them are really living with relapses of their chronic conditions, or living in fear of some kind of relapse, but were too nervous to go to the ER or hospital because they thought that would be a potential because of potential exposure. So if anything, you know, Colby and I have had to be a little bit more mindful about how quickly we fill our schedules up, so we have time to get used to the new flow and not burn ourselves out. So we've been kind of reaching out to certain patient populations, kind of groups at a time, to get people scheduled. And we're operating probably at about 50% of our typical patient load right now, just because it's not that we're not used to having to do all the extra cleaning. It's just, there's just a stronger level of anxiety. I think everyone's got COVID on the forefront of their mind when they're working in healthcare. So I think the biggest thing that we've done to kind of encourage people to feel safe and confident is just that we've been super transparent with our safe operating procedures. They were sent out on newsletters. We encourage all of our patients to read our official SOPs online. I've posted them on our website. We link them on social media posts and blogs. So we've kind of just that transparency, I think, has instilled a lot of confidence in what we're doing to make people feel safe.
Thank you. So the next question is for Dr. Egger from oncology. What are the common misperceptions about the reopening of your healthcare field? How would you address this misinformation?
So I think then this is based on the original sort of experience of folks, is like the no visitors policy. So we have definitely, most places, inpatient and outpatient, are relaxing somewhat the visitor policy. And so I was having patients not wanting to schedule surgery because their spouse couldn't be with them in the hospital, and those restrictions have relaxed somewhat, although it's sort of not unlimited or unfettered access. And I think people are scared of the hospitals. I think they're scared of getting in the healthcare system. And I've had patients just this week cancel a surgery, quite frankly, because she was afraid of getting COVID in the hospital. And I think what we need to try to reassure everybody is the hospitals may be one of the safest places to be, actually. I mean, everybody who walks in the room, they have controlled entry into the hospitals. All workers are screened every day with a temperature check. All visitors are screened. And the rate of infection in healthcare workers does not necessarily seem to be any higher than others right now, as we're sort of learning more about that as we're doing sort of routine surveillance and screening. But you know, that it's safe. It's safe to get healthcare. It's safe to get life-saving healthcare, really, for your cancer treatment. And so that's what I encourage people to understand.
Thank you. That's a very important statement. Laura, in terms of long-term care, what has impressed you the most with how your respective field has responded creatively to ensure patients have the care and safety that they need?
I think the biggest thing, you know, there was a significant lockdown, but I think during that, you know, the staff has been screening the residents as well, doing twice daily temperature checks, as well as the staff and the things I spoke about earlier. But I think the thing that has most impressed me about the industry has been the creative ways that they've tried to increase communication and socialization for these residents. Because as we know, in our older adults, isolation is such a harmful thing, and being socially isolated and distant from their loved ones or from their regular socialization and routines, including activities, whether it's bingo, whether it's exercise, that's very hard for these residents. Early on, one of the first activities I think a lot of facilities did was hallway bingo, to try to do it at the door to their room so they were socially distanced. Then it's gotten more creative and they're using the technology. So some people are broadcasting things over TV systems in some facilities so that they can do exercise in that manner. There's also been an increased use of technology, which has been really exciting to see. And hopefully I don't think that's going away. I think it's here to stay, using iPad, Skype, Zoom, doing FaceTime visits. And so the staff's been really instrumental in helping them connect with families. Other facilities, if they have a floor plan that allows it, are doing window visits. Some places have been created these kind of visitation porches or patios where they've enclosed areas to allow loved ones to come and visit, where you don't have a screen, but you can do it via telephone so that you are able to see your loved one and be close. And I think that's been really wonderful. The other interesting creative thing they've done is a lot of drive-throughs. I think people, and especially as Father's Day is coming up, they're looking at doing drive-throughs. So some socially distanced outdoor drive-through to see your loved one, to try to allow that. I think that's the biggest thing that they've done, and really all those other measures that we talked about earlier have been impressive to the degree to which they've been done. I think I'm still amazed at how fast everything was really tightly closed down. And I think that prevented a lot of spread because, as you know, from the numbers I told you, that's where a lot of the deaths have been, in these congregate living settings. So I think it's been essential, but I'm really most appreciative of this use of creatively engaging our residents to try to help with that quality of life, even while we're all struggling to make it through COVID-19.
Thank you. So the last question is for all the panelists again. And the question is, what would you recommend to patients who are scared about seeking care with your respective field due to COVID-19 concerns? Are there universal questions patients should ask their providers, or perhaps safety tips that are specific to your field? Dr. Egger, you first.
So I would encourage folks to be very direct in your questioning. What are your fears? What exactly are you worried about? And ask your provider exactly about that, right? Are you worried about getting COVID from coming to the office? Are you worried about a healthcare worker infecting you? Are you worried about delaying your tests, right? So there's a lot of trust that we have to build with our patients, because we certainly delayed a lot of treatment and surveillance over the last month or two to try to relax the stresses on the healthcare system. And so have that open dialogue with your provider, to really figure out what the questions, what really is, what your concern is. And then I would always say, ask for a telehealth option. I think in the vast majority of cases, most practices have the ability to assess you via telehealth, unless it's a certain type of procedural thing that needs to be done. So I would encourage folks to, if they're concerned about coming in contact and coming to a centralized place, to ask about telehealth options.
Thank you. Dr. Hill?
I agree that I would encourage people to be very frank and ask questions, and ask specific questions if you have concerns. We could talk about this stuff all day. If folks ask questions, we certainly we'll do our very level best to try to help them understand how we are addressing their particular situation, or sometimes special arrangements can be made. The people who are the most vulnerable to this virus are people that are definitely in some of these groups that we've been talking about. And I would encourage those individuals to ask for things like perhaps the first appointment of the day in a dental office, or if they have a procedure that requires a lot of aerosols, maybe the last appointment of the day would be a good thing for them. We can certainly, there are a lot of accommodations that we can make to help people be more comfortable, but I agree that all of us have delayed a lot of procedures and put off a lot of things, and now we're having to kind of catch up. And there are dental disease nor any other kind of disease waits for the virus. It's still happening out there at the same rate that it's always happened, whether or not we have the virus, and we've had to deal with those things throughout this. We're getting pretty good at it. And if people are uncomfortable, they need to asking questions and helping us be creative about solving them is probably the best approach.
Thank you. The Heltons.
Yeah, so acupuncture is actually really conducive to operating in a situation like this, where minimal contact with patients is done just to prevent transmission of the virus. So the telehealth options are really good for kind of planning out maybe a treatment. You can kind of do all of your discussion of medical history, and then when the patient comes into the office, you can get right to the acupuncture. A lot of the points that we use tend to be kind of on the hands or the feet, so we can stay pretty far away from having like face-to-face contact. Like I don't need to be up in a patient's face and with it, we can almost maintain 6 feet face-to-face if we're if we're working on a patient's legs, or if we're working on somebody's back, they're facing the other direction. So that's really useful. The actual needle insertion part of it is really quick. And then we leave the room and let the patient kind of relax with needles in. So there's not a whole lot of patient-to-patient or practitioner-to-patient contact. And so it's really decreases the risk of transmission that way. And then herbal medicine is an option for patients that don't want to come into the office. We've been actually doing a lot more of our kind of herbal practice, which not every acupuncturist does. It depends on kind of where they went to school and when they went to school, how well trained they are in that. But that's kind of an option. But I definitely understand there being anxiety for coming into the office. And so I would just really encourage patients to keep in mind that acupuncturists are very rigorously trained in kind of the cleaning procedures and being completely sanitary and everything. And then additionally, all of our COVID operating procedures, on top of that. So, seeking integrative care anywhere, outside of our practice, I would definitely look for written COVID operating procedures. All acupuncturists in Kentucky should have them. Andrea wrote them and made them available to everyone in the state via the State Acupuncture Association. So they should be out there. And for me, the main things are make sure they're doing some sort of screening, whether that's temperature checks or a questionnaire, and obviously PPP is a big thing. Typically, we don't wear masks under normal circumstances. So during the COVID procedures, if your practitioner isn't wearing a mask and asking you to wear a mask, it's probably a bit of a red flag for me. We've had some patients that say, hey, if you don't want to wear the mask, no big deal. Kind of want to bend the rules, and we kind of gently remind them, we're the ones that kind of put the rules in place as far as kind of how we operate. So we don't mind wearing masks. We're very happy to do that, and most of our patients are actually really glad that we're taking every precaution. But I definitely make sure they have some sort of kind of COVID protocol in place.
Thank you. And lastly, Dr. Morton.
Yes, so I think it's a little bit different in the long-term care congregate living setting at this point, because there are still so many visitation restrictions, and each facility does have their own policies about what happens if someone leaves the facility and if they go to an appointment. I would definitely encourage families, if they're going to take their loved one out for care, to really talk to the facility administration and nursing staff to figure out what the guidelines are there. Is there, if you go out to a facility, is there going to be some kind of quarantine when you come back? So you have to be aware of that. So I would encourage you to talk to the facility. However, if there is necessary medical care, you need to seek medical care. A lot of the long-term care facilities have a medical model, so there's nursing staff there to help families and patients make those decisions. So that is helpful. But if there are non-emergent, non-urgent things, again, and we could schedule those at a little bit later date, I think I would encourage that as we're moving toward the wider spread screening in these facilities. Once that is done, I think it'll give us a better baseline of knowing what is out there in these facilities, which is where that state recommendation for the increased opening toward the middle of July is coming from. But again, just talk to the facility itself to make sure, because then there has to be transportation arranged, and how do we safely transport. A lot of these facilities have been working with certain companies that they know have these cleaning procedures to allow safer transportation of the patients to the appointments and then back again to the facility. So again, you want to make sure you talk to them and have that open, honest conversation about how you get them there. But again, if necessary care and you need a follow-up appointment, if you had some kind of orthopedic procedure and it can't be done via telemedicine, we need to take you and make sure you get that follow-up care. Absolutely.
Thank you, panel. This was great. It was a great discussion. I'm now handing it over to Justin to read some of the questions in the chat.
Okay, hold on just a second. So Dr. Morton, is antibody testing available in Louisville?
So the University of Louisville Envirom Co-Immunity study is actually received some funding to extend it out into the community to look. Originally, the study was to look at antibodies and COVID in healthcare workers. They did get some extra funding to do that, so I think there is a link. However, at this time, nobody's really quite sure what antibodies mean. So if you have antibodies, are you immune? So that's still very up in the air, and as we learn more about the virus and what having antibody means, there will be more to come. If you talk to some of the infectious disease folks, it's still a little early, I think, for everyone to get antibody testing. So at this point, we're screening for looking for the virus itself.
And I think this is kind of for everybody. How do you handle patients who want to shake hands or hug when they see you? How do you keep the patient connection that you had pre-COVID?
I can start there, since with our approach and the kind of work that we do, a lot of our patients crave physical contact. It has been very difficult. I'm also naturally just a very I try to bring in a lot of like professional warmth into the setting. So certain patients I have, you try to give physical comfort, especially when I'm working with a lot of trauma and grief. So we don't do any physical contact that's not, actually giving the acupuncture treatment. And a lot of that just has to do with trying to create an ambiance of distant intimacy, where you still are, speaking with warmth, maintaining, compassionate eye contact, reaffirming that, we understand how our patients are feeling, that we feel for them, that we empathize for them. And so I think for us, as long as we're reminding our patients that, we're not giving physical comfort because we don't want to, because we don't care about them. It is just like, it has to be safety first. And that's like, period. There's no way around it, but we've still been able to set up a compassionate environment through eye contact, through honest and open conversation, through I call like heart-centered or like trauma-informed conversation. And I feel like most of our patients are pretty understanding of that. Yeah.
Thank you.
Have you seen the meme that says, check on your huggers, we are not okay? Have you seen that one? It's, oh my goodness, it's killing me. Joe, I understand. My advantage is I actually do get to touch people. And that has been, it has definitely, I think it's made a difference. And I find that all of those things that Andrea is talking about are absolutely necessary during this time. The patients that I have seen many of them are just undone by all the circumstances that surround us right now. It isn't just fear of COVID-19. There's all sorts of things that are going on in our world right now that people are feeling very deeply. A lot of people are, and to be separated from that physical comfort has been extremely difficult. And I think that I get, sorry you all, I get an advantage on this one because I actually do get to touch people. Maybe not in the way that I did before, but I'm still able to offer some a physical contact in a little bit different way that is that I think it's been really helpful. You can feel people just relax under your hands when you're working with them right now. So, but Joe, I hear you, and you know me all too well. You know this has been very difficult, and I know it's difficult for you. But I think it's even more important to be able to convey that sense of calm and comfort and all of those things that we all do in every case, I hope, but even more important now. But it is definitely a challenge.
And Dr. Hill, the next question is kind of for you as well. If you have a dentist in the rural areas with a small practice, how do we ask questions about aerosols?
You're on mute, Margaret.
Sorry, I keep hitting the wrong button. That's an easy answer, actually. All of us agreed through the Kentucky Dental Association, through the Kentucky Board of Dentistry, through both the schools of dentistry in Kentucky, through the Kentucky Dental Hygiene Association. Representatives from all those groups got together and created the plan for us to be able to begin elective care again, which we were able to do on April the 27th. That was the first date that we were allowed to resume elective care. We've always seen urgent and emergent care patients throughout, and as a matter of fact, we had a mandate to try to keep as many dental emergencies out of emergency departments as was humanly possible, which we really took very seriously here at the School of Dentistry and worked very hard to do that and have continued to do so. But we all had to agree to abide by the regulations that were set out, and we created them. So, and the governor and Commissioner Stack agreed to them. So that's an easy get. All you have to ask is, are you following the agreement that was made with the governor through dentistry? So you're not insulting anybody. You're just asking, are they doing what it is that we're supposed to do? And it covers everything. So that's an easy one. That's an easy way to ask it without feeling like you're being insulting.
Okay, good.
So this is probably a question for the whole panel. Is hugging with masks on, is there a risk of infection, and is it a safe way to greet family or friends?
I guess I'll weigh in a little bit. So yes, there would be a risk of infection. There's always a risk of infection. Recall, the masks that we typically are wearing, cloth masks, the non-N95 masks, all that does is prevent spread of your aerosolized particles to other people. It doesn't protect you necessarily from breathing in aerosolized particles. So there is a risk. Now that being said, I probably have shaken hands and hugged a few patients over the last 2 months, I will admit, when the time is right. And there is still some humanity in all of this. And so I think it's use your judgment, you understand your risks and the risks of those around you. But yes, there would be an increased risk by doing so.
And if anyone else doesn't have something to weigh in there, the next question is for you as well, Dr. Eggers. Should a patient undergoing active cancer treatment be socially distancing themselves?
So yes, they should certainly be adhering to all the sort of recommendations that the general population is adhering to now. But when you think about it, so a lot of cancer patients have been doing this for a long time. So a lot of cancer therapies are immunosuppressive to some degree, and so patients have been taking these sort of precautions, wearing masks in public, and limiting sort of interactions with sick contacts, things like that. They've been doing this for a long time. They've been doing this before the COVID. And so this is to some degree part of their routine, but they should certainly be doing so in this pandemic.
So this is a question for Dr. Morton. Considering the media is lumping nursing homes and assisted living under long-term care, it's creating increased anxiety in potential residents and families. The need to move from home, rehab, or hospital is still there. Understandably, 60% of deaths have been in long-term facilities. How can we rally together to articulate this message to Governor Beshear?
That is a great question, and it's one that I think across the United States, everyone's struggling with. The national organizations are really looking at guidelines, and really, I think the problem is that a lot of this is lumped under congregate living, which includes people with developmental delay or even some of the group homes that exist out in the state. So I think with that in mind, it even goes beyond long-term care versus assisted living. However, on the long-term care task force, Dr. Furman and myself are on that task force with the governor's office. We provide the medical side and give recommendations to the state, and hopefully when we can advocate for our residents and trying to, again, understand that we need to open things up. And I think everybody does recognize that, especially as the pandemic has gone on longer and everyone's seeing the side effects or the adverse effects of the isolation and not being able to go into those facilities when you need it. The other thing that we continue to do and work with the industries as well is to advocate for helping families and patients understand that it is safe to go into these facilities, that they are doing as much as they possibly can to limit the spread of COVID. Even though a lot of deaths have happened there, these facilities are working so hard and to keep them as safe as possible, and that it is actually, and it may be possibly safer than being out in the community as well, depending on how many contacts someone has. So it's really just continuing to advocate and talk with the Department of Health, the professional organizations for assisted living and long-term care are also in regular contact with Adam Mather, who's with the Office of Inspector General, and really just keeping that continuing conversation to advocate. And I think more is to come, and hopefully some of those, as those restrictions are loosened, everyone will feel more comfortable with that. And I hope that answers your question.
And so the next two questions is for the panel. With family members returning back to work, how do we navigate our home life? Should we socially distance with our family members since they are back out in the community? And are there extra precautions recommended for those with autoimmune conditions?
I'll start with that. So for the autoimmune conditions, I would say, so a lot of the treatments for autoimmune conditions are some sort of immunosuppressant, anti-inflammatory. And so they would have a similar risk as patients undergoing chemotherapy. And so they would just be recommended to adhere to the recommendation, but I'm not aware of any additional precautions that they should be taking other than just really recognize that they are at higher risk. With regards to family members, right, this harkens back to, I think, some of the stories that we heard early on with like ER physicians not going home when they were sort of taking care of these folks, like in the midst of it all. And so I think to answer that question, you have to consider your own risks and the risks of your family member going out into the community. I think in that situation where you had a family member that was like actively taking care of active COVID patients, and if you were a particularly high risk at home, I think it made sense. I think it was prudent there to socially distance. I think if sort of medium term, regular sort of risk, and then if your family members are just kind of going back out to their sort of jobs that may not be in the healthcare industry and being exposed, there aren't any recommendations necessarily to socially distance within a household.
And I would add there, just from as a geriatrician, our patients many times just by their age are immunocompromised, so they are at a greater risk. So for people over the age of 65 or those with a lot of chronic medical conditions, you really have to balance that risk and benefit. So a lot of times you have to look at how many contacts you have. And if you are working with active COVID patients, I would encourage you not to get near those high risk populations. However, if you're a primary caregiver for someone who lives by themselves, who is in a high risk, you have to think about safer ways to interact, whether it's bringing them groceries and dropping it on the front porch, or whether it's trying to visit through windows. I think it's the way to try to look at safer ways to do those things. But there are risks with everything, and you want to just look at that risk benefit ratio. If you live in the same house, though, you've probably already been exposed, and you're with each other all the time. That's a different scenario. But if you're going to visit your parents, grandparents, you really have to look at their overall health condition and what your exposure is as well.
I would like to comment on an angle off of that we have found. I never got to stay home. I was engaged in I've been coming in and working with patients and doing the whole business the whole time. My risk is not as high as someone who is in direct care with someone who is actively experiencing COVID-19, but my risk has been a little higher than someone who was able to stay home, for sure. But one of the really interesting things that we are seeing, and I think it's a phenomenon that's gonna become more and more obvious as we get back into folks being able to come back into the work environment, is the fear that someone has who has been at home for this period of time, and then they're being asked to come back in. We had to furlough a lot of our folks, and then a lot of people were asked to work at home if they possibly could. Coming back into the work environment is proving to be a real challenge for some of these folks, and it is something that we're going to have to address, I think, from a mental health standpoint. And we in dentistry aren't real good at the mental health stuff, frankly. But our workforce, and I think it's going to affect a lot of people that are coming back in. The other thing that's really interesting is talking to individuals who are facing the choice of choices with childcare and putting children back into daycare types of environments, or whatever kind of thing you want to call that, and making the decisions about childcare versus work and putting their kids back into a situation that they are uncertain about. I think there's all kinds of guilt, all kinds of worry, all kinds of anxiety, all kinds of things that are bubbling up here that we don't know a lot about yet, and it's going to have to be addressed. And it's going to have to be addressed in a much larger way than what we've been accustomed to before. It's kind of a sidebar of that question, but it's one that I'm facing on a daily basis right now. And it's not just patients, it's also the people that work in these environments. We need to be very sensitive to that.
Thank you, Margaret. That's really a very important statement that actually could justify a whole session on its own, just to talk about going back to the job and all the fears associated with that. So we'll take that under consideration. I want to thank everyone. It's 10:59. We're at the end of our time. Thank you, panelists. You all were very great. We really appreciate all the insights you've shared with us. And just thank you for everything you do to keep us all healthy and safe. Thanks, everyone.
Thank you.